Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Hello, myself Dr. Monique Garg. I am currently head of the department at Saroj Hospital, Madhwa Chowk, and Jaipur Golden Hospital. I am specialized in brain and spine surgery, and today we are talking about about the epilepsy.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
Basically, seizure, like we said, in the brain there are so much electric activity. So basically, it's the overexciting electric activity in the brain, which hampers the body function. Like if there is any focus in the brain, which excite the neurons surrounding that, and that hampers that lead to the seizure. So basically, seizure is the overexcitability of the neuron in the brain.
What is epilepsy?
Epilepsy, when there are continuous seizure, like when it is in the syndromic form, then it's said to be an epilepsy. Definitely, when seizure has some cause, then it is considered as an epilepsy.
What are the different types of seizures and do they affect people differently?
Definitely, ma'am. There are like first, like the focal seizure and generalized seizure, tonic seizure, tonic-clonic seizure. So there are lot of definition, lot of differences between the seizure. Like the focal seizure, we said if there is particularly body part is excitable in the like if the fingers are moving, if the only the fingers are moving, that is the focal type of seizure. One part of the limb is moving, that is focal seizure. If there is generalized seizure, or the whole body is shaking, the upper limbs are shaking, the lower limbs are shaking, even there is tongue bite also, and there is clenching of the teeth, and and there is uprolling of the eyeball. So this is known as the generalized seizure. So that is the basic difference. So generalized seizure excite the brain, whole brain, but the focal seizure only excite one part of the brain. That is the basic difference between focal and generalized seizure. There are other different type of seizure like tonic seizure, chronic seizure, absence seizure also, where in the absence seizure there is no body movement. Body movements are very much normal, but only the eyeball is moving. So that type of seizure is absence seizure.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
No, there are basically sometimes the CT MRI is completely normal with on the imaging on the radiology, we doesn't find any cause. Sometimes the electrolyte imbalance can cause seizure. Sometimes there is idiopathic that no known cause exists sometime in the epilepsy. But in 30 to 40% of the cases, we find some cause, like it can be due to the hemorrhage, it can be due to some tumor, it can be due to some infection in the brain. So any space occupying lesion can cause a basically seizure, and even the hydrocephalus, when the ventricles are dilated, that can cause seizure. Sometimes we doesn't find any cause, so that is considered as idiopathic epilepsy, but we need to treat that epilepsy too.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
Basically, everyone in our India, when there is excessive movement of any body movement, any body parts, it is considered as seizure, and everyone knows like in our layman terms, dora pad gaya. But sometime when sometimes the child present, there is sudden loss of consciousness to the child. It can be one of the early feature of the epilepsy. We need to see whether it is epilepsy attack, whether this is a syncopal attack, or sometimes even the heart block can exist. Like sometimes heart even switch off for some time and again start. It is known as a heart block. So we need to differentiate the different cause of brief loss of consciousness. It may be due to the seizure, it may be due to the syncopal attack, it may be due to the heart block. So that is the rest. All like there is tongue bite, there is clenching of the teeth, and there is a movement of the body part. It can be visualized. These are the visualized clinical feature of the seizure.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Actually, ma'am, it's only in the uneducated people, like in the still in the village. Uh, it is considered as a stigma, or sometime like people usually अभी भी हमारे सोसाइटी में लोग इसका ट्रीटमेंट लाइक मेडिकल ट्रीटमेंट के अलावा बाकी ट्रीटमेंट फॉलो करने की कोशिश करेंगे लाइक पीपल टेक टू साधु संत एंड लाइक इन द पीपल से जो हकीम होते थोड़ा डलवा दिया पेशेंट को so these type of activities they are still common in our India. Rather than the medical treatment, they use prefer to follow this type of things. And it is a medical emergency. It need to be treated as early as possible, but due to the lack of education, lack of doctor facility, clinical facility, people still consider this disease as a social evil.
Absolutely. Now, let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
Ma'am, the first and the most common is whenever there is a seizure or epilepsy started, immediately we need to provide the aspiration. Aspiration means sometimes the respiratory secretions, sometimes the our food, whatever we have eaten before the seizure, it can be aspirated into the respiratory tract. So immediately when such thing happen, we need to turn the patient to one side such that there is no risk of aspiration, and immediately we need to shift the patient to as near to the nearby hospital so that seizure can be uh, another seizure can be avoidable. That are the main thing. And if there are like seizure, it's a clinical evident thing. Whenever like the movements are excessive and tongue bite, up rolling of the eyeball, and these are the evident clinic. Sometimes non-clinical evident, like if there is up rolling of the eyeballs, this can be seen by the patient attendant. And we need to, if one seizure can come to the patient, there are high chances that another seizure can happen in the near lifetime.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
Ma'am, basically, lifetime, these patients need to prevent the driving also, because this patient in the house, we need to remove the sharp, like the tables, the corner of the table should be protected. And every time with with such patient, we this patient need not to be stay alone. Everyone should at least one person should stay with this type of patient, because even on the tablet we have seen.
Thank you so much, doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
There is no effect of putting the spoon in the mouth, putting the no effect, and putting the like sometimes they put the shoes near the nose. These type of things will not help. Immediately, I just say one thing: turn the posture of the body, and immediately taken to the medical facility as early as possible. And sometime in the today's world, there is spray also, that is midazolam spray. If a seizure, if a non-seizure patient, the midazolam spray must be at the home, and it immediately you just need to spray the midazolam in the nose, and the seizure can be aborted that time if the medical facility is too far away.
Thank you so much, doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course.
Ma'am, I just want to say seizure is a curable thing. And first and most important, it is preventable. So don't fear about the seizure. You can still have a very, very much normal life, and just you need to take the precaution. Yes, definitely. It is curable also if you are on the medication continues. If you are having not any, if you continuously on the medication without any skipping, it can be cured. And I just say seizure is preventable and it's a curable disease.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.